We will prescribe a bridge when one or more teeth are missing and there are healthy teeth on both sides of the open space. Bridges can be made from 3 types of material: solid gold for reliable long wear, porcelain fused to a gold base for strength and beauty, and high-strength metal-free porcelain for optimum cosmetic results. After your mouth has been anesthetized, we begin by preparing your teeth to make room for the new bridge. When your teeth have been prepared to our satisfaction, an impression is taken of the prepared teeth that will be sent to a dental lab. A temporary bridge is then used to keep the teeth protected until your permanent bridge is placed. When the impression arrives at the dental lab, a model of your teeth is made and work begins to create your new bridge. We use the services of top lab technicians who will artistically recreate the look and feel of your natural teeth. When you return for your final visit, the bridge will be customized to your bite and cemented permanently in your mouth using the latest technology in dental cements. With proper care, your new bridge will increase your overall health and instill confidence for years to come.